Thank you everybody in person and online for joining our final Summer Scholars Series event. My name is Paul Young, WHRI Assistant Director. So we'll start by acknowledging that we are in the traditional, ancestral, and unceded territory of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh nations, and that this acknowledgement, gratitude, and respect extends to all the First Nations communities on whose traditional territories the WHRI builds relationships. Next slide. Thank you. So this series is part of our strategic framework for trainees, including summer students. And next slide. And we're so thankful today to have Sabina Vohra-Miller to join us for this last talk of the year. Sabina Vohra-Miller has a master's in clinical pharmacology and toxicology and is currently a Doctor of Public Health candidate at the Dalla Lana School of Public Health. Sabina is the founder of Unambiguous Science, an educational platform that aims to make science approachable, and the co-founder of the South Asian Health Network, a volunteer-based organization focused on culturally appropriate health education, content, and advocacy. Sabina's passions include science education, especially countering vaccine misinformation, the promoting and advocating for health equity and access to healthcare. As a first-generation immigrant, she believes strongly in community-based approaches that help build a more resilient and equitable Canada. So before I pass the podium to Sabina, just a few technical pieces. So for questions, those that are in person, there's microphones in front of you, just press the button. And for people who are online, use the chat and Nicole Presley will ensure the questions are delivered to Sabina. So Sabina, thank you.
Hi, everyone. Thanks for having me here today. I can't see your beautiful faces, so if you have any questions at any point, please just shout them out. I really do want to make this as interactive as possible. And really, before I get into the meat of my presentation, I'm going to take you guys through a couple of slides with examples of scientific communication. I don't want this to be didactic. I mean, it's like as if I was doing a presentation on how to be an Olympic athlete. It can't exactly do that, with a didactic presentation. So I want this to be interactive. And so when we go through these next few slides, I'm going to show you a couple of things. I'm going to ask you a couple of questions, and please just feel free to shout out your responses and your answers, your thoughts, etc. And throughout the presentation, even after, I'm going to give you lots of examples, again, for the same reason, because SciComm, science communication, can be such an abstract concept that it can be a little hard to wrap your head around. So anyways, with that, let's get started. Okay, so this post was actually, it was tweeted by Health Canada. I'm going to say this was, I think, probably a year or 2 years ago, and I remember taking a screenshot right at that point. When I voted on this poll that they posted on Twitter or X now, I wasn't entirely sure what the answer was. I mean, I had a fairly good guess, but I didn't know what the answer was. It doesn't tell you what the answer is after you answered the poll. And if I went through the previous tweets that they had and the tweets that they had after, there was no mention of it. And so I came back the next day to see whether they actually posted any information on this. And there was actually no response. And so up until this day, I guess it's almost 2 years now, I actually still don't know what the right answer is. And the reason why I bring this up is because here was a perfect example of like a missed opportunity for learning. I think the answer is at room temperature, but maybe I'm completely wrong, and maybe I'm doing the wrong thing, defrosting my shellfish at home. Who knows? Okay, so that was really quick, and that was quick for a reason. And the reason for that is because most people scroll through social media really quickly. And very often you have less than 10 seconds to make an impression on someone's mind. And so we went through that really fast. But if you weren't paying attention, you'll have one more chance to do this. Okay. What do you remember from that last post? Does anyone want to just shout out something? Anything?
Use the mics, you guys. Just push the white button. The white part.
Infertility.
Okay. Anything else?
COVID vaccine.
Mm-hmm.
She's wearing scrubs.
Okay. Perfect. Anything else before we move on? Fortunately, I can't see the room, so it's hard to tell. Okay, going to move on. So when this post actually came out, I had a lot of followers send it to me because they wanted to show me, I wanted to get my opinion on what was happening with this. And so a lot of people actually didn't even go on and watch this person's video. Indeed, she is a healthcare provider. And if you actually watch her video, it had 62,000 views the last time I checked on it. She actually goes on to talk about the evidence of COVID-19 vaccines. But the first thing that struck people when they messaged me was, this looks bad. Does it cause sterility? I mean, I see this big injection in there. Like, her expression seems like she's very unsure or anxious or afraid. What's going on over here? And so, I want to take you through these examples. On the left-hand side, you essentially have two posts that are very similar. One talks about sterile. The other one has the results are in COVID vaccine and infertility. And this is big gasp on her, on the lady's posts. Whereas on the right-hand side, here are two examples of SciComm on, again, the exact same topic. One of them is actually by Science Sam. I don't know if you guys know her, but she's amazing. She's Canadian as well. And so here she's listed 8 reasons experts recommend COVID-19 vaccines in pregnancy. And then the other one over there is actually by the Australian government. It says COVID-19 vaccines do not cause infertility or sterility. Goes on to talk about the data that there's no evidence, et cetera, et cetera. And so the reason why I wanted to highlight this is because I think very often people use the shock response to get people's attention. Unfortunately, what ends up happening is that people look at an image and that terrifies them. And what they take away from it may not actually match what the content of the actual video or the information piece is. And so the people who messaged me about that one specific video did not watch the video, came away thinking that actually the COVID-19 vaccines were probably dangerous and probably would cause sterility and they probably should not get it. Again, it was like a complete missed opportunity for education. Some other examples here. So on the left-hand side, there's this post that sort of goes over a whole bunch of different things. It's too new, the vaccine. It's not natural. Natural immunity is better. I have a strong immune system. There's actually several slides on this, and I think there were 20 other headlines that were included in this. And then on the other side, right? And so here you see from the very beginning, there is zero evidence that COVID-19 vaccines cause cancer. The vaccines are not causing turbo cancers, and it goes into all of this information. Again, this is a fantastic SciComm account called Unbiased SciPod. And again, over here, the issue is you can see on the left-hand side, the things that catch your eye at, the very beginning is the misinformation. It's not actually, if you look at it very quickly, you see it's too new. It's not natural. And if you are glancing through social media posts really quickly, what you take away from that quick 5-second glance, a 5-second scroll, is essentially all the misinformation that you don't want people to have. No one's actually sitting there and reading the small print that says, actually the virus is also new, or in fact, the virus itself is unnatural, or the responses that we have against all of these commonly heard misinformation that, I'm sure all of us have come across many times over the last 4 years. And it's a similar over here on this post as well. If you look at the things that are striking on the left-hand side that really, really catch your eye, the vaccine causes COVID-19. The COVID-19 vaccine was rushed to market. COVID-19 vaccine causes sterility. But if you actually look at, this was actually posted by, I'm not going to name who on this post, but it was actually posted by a school of public health. And it was very unfortunate because, again, if you look at this very quickly, you'll see that the things that highlight or catch your eye the most are basically the myths. But if you actually look at the small print underneath, it actually says the information you want people to know, where it actually debunks a lot of these falsities, but you wouldn't know that. And if you were looking at this very quickly, this would basically reinforce all of the misinformation or all of the the things that are completely inaccurate and untrue. And on the right-hand side, there's another health department by Stanford, and they basically list over there 5 reasons why the COVID-19 vaccine arrived quickly. And it actually talks about things like, we had done years of previous research into a similar virus. Thousands of people volunteered to participate in the trials, et cetera. So it actually gives you that information right away. So if you look at it very quickly, you come away feeling more reassured as opposed to taking with you some of that misinformation. So this was another post that I thought was very interesting, right? And so on one hand side, you have basically something that says COVID-19 vaccine fact. If you've still had COVID-19, you should still get vaccinated. Now, the issue with, sometimes being a bit too directive, like you see in a post like this, is that having these top-down approaches where you tell people this is exactly what you need to do and nothing other than this, we know in healthcare backfires, and it has, it backfired throughout COVID. We saw that quite often, and it just simply doesn't work. Whereas if you look at the post from CDC right underneath it, there it actually explains to you: have you already had COVID? Well, actually, did you know that studies show getting COVID-19 vaccine after you recover provides added protection to your immune system? So it actually gives you or arms people with information so that they're still, making that decision and that choice for themselves. They feel like they're still more in control of these decisions, as opposed to having this very directive top-down thing being thrown at them. Okay, so this one's another one. And so again, like on the left-hand side, this was a fantastic post. It was the link between the Johnson & Johnson vaccine and Guillain-Barré syndrome. But again, what do you see over here? You see a big syringe, you see glial cells, you see neurons, you see, this sharp needle over there, and it makes you worried about, oh no, does this mean the vaccine is unsafe? And again, on the right-hand side is this fantastic post made by the World Health Organization that actually takes you through what is exactly, Guillain-Barré, what does it do, what causes it, what the risks are. It has all the information out there for you to see, even if you are quickly glancing through a post. Whereas on the left-hand side, that imagery, it's used to catch people's attention, but there is such a thing as bad attention. You don't want that kind of attention on things that are already contentious and can be very easily misconstrued. Okay, so this post, I'm gonna let this linger for a bit, but I want to come back to this right at the end. So again, if you had to compare these two posts, the one on the left-hand side essentially vastly underestimates and downplays VIT. I don't know if anyone is familiar with VIT. It's the vaccine-induced immune thrombotic thrombocytopenia that we saw with some of the viral vector vaccines, particularly AstraZeneca. Here in Canada, we didn't have very much Johnson & Johnson, but we saw it mostly with AstraZeneca. And so there are these two posts. On one side, you have this post that basically is downplaying the risk that we saw of a very real, very severe side effects. It was not just a simple, blood clot that you would see, for instance, with birth control pills, for instance. And on the right-hand side, it's just a word salad. And here's something I'll share with you. The one on the right-hand side was actually a post I made in the early days. So again, let me be clear. It's not like I don't claim to know everything about science communication. In fact, a lot of it was not learned. It was just something that was very iterative for me, where I saw what worked, what did not work, and I made tons of mistakes along the road. And so partly the reason why I'm actually here speaking to you today on science communication is so you can learn from my mistakes and you don't have to make the mistakes I made. So I'm going to come back to this post because I think this, we'll put this into context once I talk about a couple other things. But you can see here, there's one on one side that is trying to break it down into too much, but you're basically underplaying the risks. And on the right-hand side, you're just giving word salads to people. People don't understand any of that. It's all jargon. with that, what I want to start with is basically a quick introduction. So as you heard, my name is Sabina. I am heading into my fourth and hopefully last year of a doctor in public health program at Dalla, Lana at U of T. I have a master's in clinical pharmacology and toxicology, and I worked in biotech as a scientific advisor formally for over a decade before I left industry altogether. But I've always been passionate about sharing science in a story-like format. When I got pregnant with my son, I realized how much vaccine-related mis and disinformation there existed on social media, particularly on Facebook groups. And I joined several vaccine on the fence type groups to try and help people understand vaccines and the benefits of vaccines, but in a way where I actually try to address what their concerns were. And through storytelling, actually through sharing anecdotes of myself as a first-gen immigrant, I did not grow up in North America. I did not have easy access to vaccines. I had a kid in my classroom who actually was in a brace due to polio. And sometimes it was basically just sharing some of these personal anecdotes and trying to talk about vaccines more in a story format instead of actually just throwing data at people or telling people, well, how can you not vaccinate? I mean, it's like, common sense, etc. Because what I realized through all those years of countering vaccine related hesitancy is that a lot of that just simply does not work. And so through that iterative process, it was basically trying to understand, how do you connect with people on a more emotional level? How do you actually talk to them? How do you alleviate their concerns? How do you listen to them and hear what their actual anxieties are? Because again, these are parents, first-time parents very often. They're trying to do the best for their child. They're scared. They come across all this, very scary sounding information, and they don't know what to do with that. Very often they're too scared to speak to sometimes even their healthcare providers because they don't want to be judged. And so instead of asking their healthcare provider or, their physician, their pharmacist, their pediatrician, they end up asking, of all places, on a mom's group on Facebook, which, I understand, but I also don't understand. But, so I think a lot of that experience for me on trying to counter this came through speaking to moms on Facebook groups. And then, of course, COVID happened. And I began sharing what I knew about the mRNA platform, given I was working in immuno-oncology when I was in industry in biotech. And so I took some of that information, that knowledge that I had, and through that, Unambiguous Science was born. I am on Facebook, I'm on Twitter, X, and on Instagram. I suck at making videos. For whatever reason, I just don't know how to do it. So I'm not on TikTok. But I'm just going to, I'm going to share, 3 key reasons why I communicate science on social media. And so the number one reason is because that's basically where people are, right? If you look at data and you look at stats, you'll see that 85% of adults say they go online on a daily basis, of which 75% use social media platforms. And a huge majority of these folks are actually using social media platforms to get health information. So either it is health information about something they're just curious about, something that they're actually concerned about for themselves. Sometimes it could be questions that they have on their own health or their family members' health, but very often they go to social media to obtain health information. And so we know this. And there's, we can talk about how social media is the absolute worst for misinformation, or we can do something about it, right? So those are our 2 options. Either we sit here and we lament about social media being the worst ever thing, or we try and leverage it to actually get good information out. So which one is it going to be, right? And so if you're trying to meet people are online, that's where you get to meet them. Second of all is on reach. And so, and I post these numbers really because my husband actually he worked at Shopify, and he for a while was leading their marketing team. And One of the things that he would keep telling me in my early days when I was on, these mom groups and talking to people one-on-one was like, there's only so much impact you can have talking to people one-on-one. The thing you can leverage about social media is that you actually have the capacity to reach a lot more people. And I think this was the first time where I took his advice to heart and I created Unambiguous Science. And, with some of my early posts, I started measuring analytics. I don't do this as much anymore because to me, it makes sense. But in the early days, I was trying to understand where should my energy really go into, especially in the early days of COVID. And so, there was this post that I made on Moderna versus Pfizer. And so this was a period in time where people had started getting their first doses. A lot of people were vaccinated with Pfizer. And then we had a Pfizer shortage as we were heading into the Delta wave. And we were trying to get people to get double vaccinated at that point. And we had tons of Moderna. But the way it was in Canada, in US, we had Dolly Parton. She was all about Moderna. Moderna was loved. But in Canada, we didn't have as much experience with Moderna the way we did with Pfizer. And so people were just flat out refusing to mix and match and to get Moderna after their Pfizer. In fact, even Dr. Theresa Tam did that. She had Pfizer first and then she had Moderna, but it did not matter. People were refusing Moderna. And I actually got texts from a few of my friends who were on the Ontario Science Table saying, we need to get people to be comfortable with mixing and matching so they can get their second doses. What can you do to help? And so I made this post essentially, with a little pharmacology, a little immunology, and talked about the differences and why, in fact, mixing and matching probably is a superior choice, in fact. And so, again, like there is absolutely no way I could personally have spoken to 1.1 million people. There's just no way, no chance of that. But that post went completely viral. Snippets of that actually went into tons of media as well. And it was interesting because 2 years after that, I actually saw one of my sales associates at this cute little store that I would go to. And I saw her and she was like, oh my goodness, I gotta tell you, I actually was like I had gotten my first dose of Pfizer. I didn't know what I should do, whether I should wait or not. And then I saw on the newspaper something that you had written about how it was good to mix and match. And then I went back to my pharmacy and said, okay, I'm ready. Give me my Moderna. And so it was wild to see the amount of reach that I had because I was not speaking to the sales associate. I had no contact with her for those 2+ years of COVID. And then when I saw her again, she remembered that she read about mixing and matching on something I had said somewhere, and that was the reason why she ended up getting her vaccine. Again, like if you're looking at some other metrics, I know the metrics from Twitter is old, it's from 2021, but analytics on X right now is like impossible. It's actually broken for the last few months, and so I actually used something from the past. This is Instagram from earlier this summer. But again, there is absolutely no way I can actually have conversations with these many people. But when I am on social media creating posts and engaging with people, these are the numbers of people that I'm able to reach. And then the last and most important reason is, if not you, then who, right? And so if it's not you, you as healthcare providers are not providing credible, accurate information out to, the world, what is happening is that there is an information or credible information gap. And that vacuum, there are tons of disingenuous actors who are waiting and willing and happy to pounce into that and take up space. And so that is where you have folks like Joe Rogan, John F. Kennedy, Larry, all of these people, the disinformation dozen who are out there monetizing this misinformation because it actually, obviously clearly helps them. And so if you see, there is data to show that consumption of social media is a significant predictor of vaccine hesitancy. In fact, there is so much data that is coming out now, even on COVID-19, where it shows that the more an individual relies on social media for information, the more likely they would believe conspiratorial type of theories and misinformation related to COVID-19. And so it brings me back to that same point that I said earlier. Social media is here to stay. It's not going anywhere. So either we can sit on the sidelines and lament about it, talk about social media being the absolute worst, or we can actually do something about it. And the thing that we can do as healthcare providers who do have access to our own research that our colleagues are working on, et cetera, is credible information that we can then put forward to counter a lot of this mis and disinformation that we see rampant on social media. So again, as I said earlier, I don't claim to know everything and anything about science communication. And actually, a lot of it is because there is many different ways to do it. The type of followers that I have are looking for certain kinds of information packaged in certain types of ways. So there's tons of different ways to do it based on what actually works with you, what your strengths are, what you want to talk about and how you want to talk about it. But what I can do over the next few slides is essentially share what has worked for me, and a couple of things to just keep in the back of your mind when you are out there talking about science and communicating science. So, I think one of the biggest advantages of using social media for science communication really is that relationship building. So back in the day, until, I would say fairly recently, the deficit model was used essentially very widely in science communication. And that is essentially unidirectional. So it's one directional, top, bottom, scientist knows everything, public needs to be informed, right? And but now with the democratization of science, I think we are understanding some of the valid criticisms and some of the disadvantage of using this model. And so now what is slowly taking over is more of this dialogue model or this public engagement with science model. And this is essentially more of this bi-directional model where you have mutual respect between the scientist and the public. There is that bi-directional flow of information. There is that open discussion, open sharing of information and relationship building. And very often, it's coming from a scientist directly versus, a top-down health agency, for instance. So people are aware of that there is a person behind that information, person behind that account. That actually goes a really, really long way. And so, I post this over here. There was this one article that came out, and there've been a couple actually of this. And so I think these are 2 articles, sorry, that I post snippets of, but it's from essentially folks who identified as being anti-vax and how they changed their mind and why they changed their mind. And so one person here writes, if you're feeling frustrated by people who are refusing to get the COVID-19 vaccine, the answer isn't to try and scare them or make them feel worse. It is to provide facts with kindness, right? And so with the understanding that there is apprehension, how do we actually alleviate the concerns that they have? And how do we actually talk to them with that judgment-free, respectful manner? And of course, I think for me, I was reading one of these articles and I'm like reading through it. I'm like agreeing with so much that is being said. I'm like, yes, completely agree. Wow, what a fantastic article. And then of course, right at the bottom, there's a little thing that says, here are some of the Instagram accounts that helped me educate on vaccines and viruses. And I see my name on there. And it was just like mind blowing. Sometimes when you look at, the work you do, you don't really realize you're having an impact. And then you actually read accounts from folks who, changed their mind on vaccines because you had a conversation. And then I actually went back to my DMs to see if I actually spoke to her. And I realized I actually had tons of conversation with her where we talked about anything and everything. And it was just such a learning opportunity and moment for me as well, because I have these conversations and I forget about them and I don't really realize what happens downstream. But, there is such a huge impact that can happen. And so I think that, remembering that a lot of vaccine hesitancy stems from fear and anxiety and distress is exceptionally important. And I think part of that comes from the hat that I wear from the South Asian Health Network, whether it's racialized populations who rightfully are distrustful in health institutions and governments. I can tell you in my early days of educating on the COVID-19 vaccines, I would have questions from the South Asian community basically saying, well, we feel like we've not been protected throughout COVID so far. My employer is not giving me sick time. I have no access to masks. et cetera, et cetera. And now you're telling me I need to go there and get vaccine first. Like, how do I trust that this is, not being experimented on me? And I can't tell you the number of times we answer this question as literally the first question when we did some of these vaccine education sessions. And then, of course, you have, parents of little ones who, again, are apprehensive because they feel that weight of like keeping their child safe. A lot of this comes from anxieties. And so it's important to hear what people's concerns are, ask what their questions are, understand where they're coming from instead of being completely dismissive, and build these relationships via open, judgment-free dialogue. And again, I can tell you that from all my years of countering vaccine myths and disinformation on Facebook groups is that the disingenuous side, the side that is out there monetizing this, they do a lot of hand-holding, They're literally holding people by the hand and making them walk to their side. That is what we need to counter with, right? And so us countering with saying, well, because I told you so, because I know more, because I've studied this for so many years, is not hand-holding. In fact, it's pushing people away even more. The other thing that, I think is incredibly important is to be nuanced in your information that you're giving out, and especially when information is incomplete or not fully known. So early days on COVID, I had this one post that I created about COVID-19 vaccines and menstrual cycles. We didn't know at that time that COVID vaccines can have a small impact on menstrual cycles. And so I had this post over here, talking about how the endometrial lining is essentially an extension of your immune system because it's chock full of immune cells, and how many different things can impact your menstrual cycles, stress, illness, other infections. We've seen it with other vaccines, in fact, can impact menstrual cycles. But the important part, which is the bottom line that people wanted to know, is that these are all temporary changes. And, they don't impact your fertility downstream. But it's important to acknowledge that, hey, there is a possibility that these COVID-19 vaccines might be changing or temporarily affecting your menstrual cycles. Instead of saying absolutely no, there is no proof that COVID-19 vaccines affect menstruation or fertility. In fact, unfortunately, this came from a whole bunch of both Canadian as well as American top-level experts where they say no data linking COVID vaccines to menstrual changes. US experts say no proof. So that was a US one. The second one was a Canadian one. No proof COVID-19 vaccine affects menstruation or fertility. One of them is true, one of them not necessarily. And then after we got, we had studies that came out that showed, okay, it's possible that your menstrual cycle might be slightly delayed, might be slightly longer, et cetera. They came back and they essentially, there were tons of people who basically felt gaslit throughout the entire time, where they said, why didn't you hear me when I said I had something, when I was trying to explain to you my experience? You basically shut me down. You didn't even try and listen. And you had, article after article talking about why didn't doctors listen to women about the link between COVID vaccines and periods. And so the issue with trust is that it takes 10x to build trust, but it takes this much instant to break that trust down. And to build it back up is going to take you even longer. And what ended up happening with a lot of these messaging with the menstrual cycles is that people lost trust in healthcare providers because they thought that they were not being listened to and that their concerns were, they felt they were gaslit with their concerns. And that brings me to communicating uncertainty. I think us in healthcare, particularly I feel in public health, we don't know how to communicate uncertainty, and we don't know how to communicate it properly. And so this was actually a piece I wrote for Healthy Debate, what we can learn from the evolution of guidance from the COVID-19 pandemic. And, I think one of the things that I wanted to highlight was that a key learning from this pandemic should be on the importance of effective, transparent, and reliable communication that builds uncertainty into guidance, because we're not going to know everything. And, here's the thing, the only absolute in science is that there are no absolutes. So as we get more information, guidance evolves. And in fact, guidance evolving is a good thing. How do we explain to people that guidance evolving means that we're actually staying true to science, we're continuing to research, we're doing our due diligence, that's a good thing that we're doing. And so how do we actually talk to people about this? And how do we build uncertainty into guidance such that when the guidance evolves, as it will always, it does not breed distrust? And that is so, so incredibly important that it, you're talking about it in a way where it's building confidence and not causing chaos. And it's also not gaslighting people. And I think truly that the future of public health depends on it. And, we saw that in the early days with mask wearing. I think our guidance in the early days was masks don't help, don't wear masks. When actually the truth is we don't know if masks can help. Maybe they can. If you have access to non-medical masks, use them, but we need to save medical masks for the healthcare providers. That could have been a way we actually communicated masks. Instead, we said, masks are not useful. There's no point in wearing masks. And then unfortunately, up until today, we're still, we're still having to deal with some of these sentiments against mask wearing because I think of how some of that communication started on masks in the early days. And of course, everything from what I've already discussed in terms of what you need to do to make sure that you are going to be nuanced and you're going to build uncertainty kind of lends yourself to credibility, right? And so you are nothing as a science communicator if you are not a credible source for information. And so how do you essentially ensure that you are making sure that all the information you provide is accurate, is up to date, is from multiple sources, free from conflicts and biases or your personal interests, identifying paid partnerships and other financial conflicts that you may or may not have. And so these are all things that you need to keep in the back of your mind. And unfortunately, I see this very often with many science communicators where the lines are blurred. And again, the issue with trust is that once you break that trust and once you plant a seed of doubt into someone, it's going to take you a lot more to actually build it back up. And so it's really funny over here. I was actually working on these slides a couple of weeks ago for another talk I was giving on a similar topic. I come out of my office, it's a Saturday morning, and I see my 7-year-old sitting down, jotting down, things on his notebook. And I asked him what was he writing about? And he tells me he's making a list of the 30 most scary sea monsters. And I'm like, okay, interesting topic, wonderful. And so I asked him, well, what's your source for this information? I'm sure you don't personally know of 30 scary sea monsters. So where are you getting your information from? And so he tells me he's watching this amazing video on YouTube, and that YouTube video was his sole and only source for this document that he was writing on sea monsters. And anyways, it was really interesting because I'm like, I'm doing this work on slides on my professional life, but one of these days I've got to sit him down and give him this presentation because you cannot have YouTube as your source and you cannot have one source for your entire write-up. But you see that so often where you have folks actually talking about things in a very decisive manner, and it's based on one study, and the study might not actually be a robust study. And we know that one study does not make consensus. And so how do we actually, again, provide that totality of information to people is exceptionally important. And so one of the other advantages that you have using social media, again, because you're not actually a print-based publication, is that you can actually be nimble and you can change things depending on what the audience is looking for. So through, Unambiguous Science, there were moments where people were really craving in-depth information. So, pregnancy was one of those areas where people wanted to read every single information that existed on it. And so this was like an info sheet that I'd made. It was 10 slides long, chock full of data, all my references included, because people, that's what they needed to feel comfortable to actually get vaccinated when they were pregnant or trying for a pregnancy. And then there were other times during, COVID where I felt like the audience was just overwhelmed with information. And so, everyone just wanted quick snippets of information that they could take away as opposed to spending, 10 minutes reading an in-depth post. And so you can change the way you meet people based on what people are looking for. And again, because you're digital, you're not waiting for the print to make paper copies of things. You can be timely. I don't know if anyone recalls, but a couple of months ago, there was this Scottish study that came out on how the HPV vaccine essentially was 100% effective in preventing invasive cervical cancer. And the day after the study came out, I had that post ready to go with that information. Same with the when the pediatric vaccines were available, that post was ready to go on Halloween. That Halloween poster was actually one of the first Unambiguous Science infographics I'd made. It was October 2020, where I talked about how do you actually trick or treat. How can you actually do it safely? Because absolutely, this is something that children can partake in a safe manner. But again, the advantage of being digital is that you can be timely and you don't have to wait for an arbitrary printer to provide to make that information available. You can be there at the front before, in fact, people are spreading misinformation. You can actually be at the forefront of giving out good information. And then I think one of the things I do want to talk about a little also is how to build science literacy. And this is so important. When I was doing some of these, so during, when the vaccines came out, I was doing 1 to 2 vaccine education sessions for the community almost daily. And I did that for months. And when I was giving these sessions, I would start essentially with talking about what your immune system is. Like, people don't know this. And what is your immune system? How does a vaccine work? How does it actually take advantage of your own immune system? So when someone says, no, thanks, I don't want the vaccine, I trust my immune system. Actually, that's exactly why we need the vaccine, because it's your own immune system doing all the work. But basically, layering that information that you're going to provide with that foundation of building science literacy up is extremely, extremely important. And so this was one of the posts I made, just talking about, how do people critically evaluate something that they come across? There's so much information out there. We don't know how to discern what is right, what is wrong, what is correct, what is not, particularly in this era of Netflix documentaries on all the cherry-picked data. But just teaching people how to do this on their own is exceptionally important as well. And of course, information can be tailored to exactly what your population is looking for, particularly if you're working with racialized or other special populations. So again, with the South Asian Health Network, one of the early posts that we'd made was, people didn't want to know whether the vaccine was safe or effective or any of that, which we thought was the top question. In fact, they wanted to know whether there were any animal products in the vaccines. And there was absolutely no Q&A available at that time from most public health sources to address these questions that people in our community had. And then accessibility. And accessibility comes in so many different formats. You have languages, you have different mediums and styles and formats. For instance, over here, we essentially, you can see the pictures. We did these town halls for the South Asian Health Network. We partnered with Toronto Public Health, as well as an ID doc, a pediatric ID doc, when the pediatric vaccines were just about to be rolled out, and we broadcasted this in Punjabi on Y Media across Canada. And it was wild to see the number of people who actually saw this. We did this at prime soap opera time, essentially. So families had no other choice but to sit down at 7 p.m. on the Saturday and watch a vaccine town hall that we were broadcasting on their favorite television. It was fantastic. And the number of text messages we got from people all across Canada saying, just saw you on TV, and whoa, cool information, etc. It was, again, you're trying to meet people where they are. And sometimes they're on Y Media at 7 p.m. watching their soap opera. So you've got to get them at that time. Well, we did similar with doing radio, Punjabi radio with the truck drivers and the transportation drivers, because we knew that they were listening to that at that specific time. And so how do we get the information out? And so again, accessibility means using different formats in different ways, alt text, so many different things that you can do. There's no one way form of accessibility, but again, thinking about your audience and actually taking into consideration accessibility is incredibly important. And of course, be culturally mindful. This was a piece that we again did for the South Asian Health Network. Essentially, it says, in the South Asian community, there is so much reverence for our elderly. And so this post resonated and was shared astronomically, was actually basically saying, protect your elders, get vaccinated in Hindi. And I did so well with the community because it actually resonated with the people of our community. And fun fact, the picture actually, that's my dad on there. And so, of course, it obviously means so much more to me as well. But people connect with this and people understand it, and trying to build in that cultural nuance is so incredibly important. And the last thing I'll talk about is partnerships. You can do all of this alone. And I think one of the best things about social media is that you're not limited on who you can partner with. So I made this, post on Novavax. And then I had an Canadian ID doc who messaged me and said, hey, do you want to write, a 5 things for CMAJ? And I said, yeah, let's do it. And so we then published essentially something very similar taken from my Instagram post, and we converted it to a CMAJ article. What's the deal with IgG4? It was actually a post that I made with a science communicator. She's an immunologist in the US. And, we connected, and we've actually now had several other posts as well. And the one on top, the benefits of vaccinating children. This is actually the Focus COVID communications, now housed at Waterloo, but actually started with a call out on Twitter saying, hey, is anyone interested in coming together? This is back again in the AstraZeneca days, coming together to make a couple of things. People don't know what to get for their second dose, etc. And this group was formed of a bunch of people, pharmacists, physicians, different types of physicians, community folks. And we made tons of other material similar to this that was then shared by a variety of different groups across Ontario. And so again, these partnerships are possible because of social media, and leverage that. So quickly coming back to this. And so, as I said, that right-hand post is trick question. That was mine. And I realized when I posted this that it was just a word salad people were not going to read. And this is when, moments like this, when I realized that the medium that I chose is basically not the right medium for this kind of a piece that requires that detailed nuance. And so I ended up writing a piece with Dr. Menaka Pai. She's now a really, really good friend of mine. But she was the co-chair of the Ontario Science Table treatment group, and she's also a kick-ass hematologist in Hamilton. And so we actually penned an op-ed together. And, one of the things we made sure we did is we put this massive cross against that risk of blood clot piece that we kept seeing everywhere that infuriated both of us on, how it was actually minimizing the risk of this really, really severe side effect. But this post was a lot more nuanced. We had the time to go into detail for it as well. But again, it was a learning opportunity that sometimes you've got to understand what information you're trying to get out and what's the best way to get that information out. So essentially, I'm going to leave you guys with one note, and that is that a one size does not fit anyone. And you've got to take that time and effort to try and meet the needs of what the people are looking for. So really cool TLDR. If you snooze for this whole thing, the only things you need to remember: be accurate, be up to date, be nuanced, be credible, be respectful. Don't amplify the myth, especially in the heading. Break down statistics and numbers people can relate to. Don't shame or blame, insult. Limit the use of jargon and complicated terminology. We love using these words. Most people don't understand a thing we're saying. Be nuanced, avoid sensational narratives, always go to the exact source, verify, ensure that the source is credible, cite references, and keep accessibility in mind. And with that, if there are any questions, I am more than happy to answer. I'm going to actually stop sharing so I can see people as well.
Thank you so much. That was amazing. Actually, I think every scientist and healthcare provider should probably hear that presentation, or that last slide. Everyone should read that. We'll take any questions from in person. Yes, I just pressed, yeah.
Hi, thank you for a very informative presentation. Can you explain the difference between misinformation and disinformation?
Yeah, great question. So the difference between the two, really, disinformation is a type of misinformation. The only difference here is that with disinformation, people are doing it intentionally. And so these are the type of people who I spoke about, the nefarious actors who are ready to pop right in. And, it's interesting because the number of a number of times you would hear RF, Robert Kennedy Jr. essentially talking about vaccines, and he's a staunch anti-vaxxer. And then the news came out that he actually got vaccinated himself for COVID-19, right? But he was maximizing that anti-vax for his own benefit. And he was intentionally putting out information that he knew was incorrect because he benefited from it. So that is disinformation. When you're doing it intentionally more often to benefit yourself, that's disinformation. Misinformation is just when people repeat or parrot information that they think is accurate, but is not accurate. Hope that makes
Thank you.
sense.
I'll ask one. What do you think is the impact of when politicians communicate scientific information, who they don't tend to be nuanced? And I think because we don't allow our politicians to have nuanced debates anymore, right? It's just quick sound bites. That's all they're allowed. So that's what it degenerates to. So yeah, what do you think the impact of that is?
Yeah, there's actually quite a bit of data on this as well. And so it's a mixed bag because you see in certain situations where politicians can have a huge impact on, especially if it's actually a politician who's representing their community, right? If you have, for instance, we had specific Indigenous communities with Indigenous leaders and politicians getting vaccinated first. And it actually did have a very positive impact within uptake in the communities. We saw that in the South Asian community as well. But of course, you also have situations where, again, there is data to show that a lot of this vaccine misinformation is towing party lines. And so you actually are seeing that this information is being intentionally sensationalized because it helps people politically. So it gets tricky and it gets complicated. It really depends. And you see a lot of that, and this is a little off topic based on your question, but we also see that with news media. So there was a really, really good article that just came out last month where it showed that, in fact, some of the most damage was actually done by news media that sensationalized. Essentially, you have the article is nuanced, but then you have editors who are making the headlines, and the headlines would not necessarily reflect what the content of the message is, and those headlines actually caused a lot more damage because they were coming from a source that people thought was an accurate source. So sometimes we don't actually look at the totality of who is causing damage when it comes to misinformation. I think very often we do like to blame, the folks that are on social media, where actually you're seeing that a lot of impact is coming from things like politicians and sources like actually news media who may not necessarily be following journalistic standards because, sensational headlines obviously are clickbaity and they're catchy for a reason. So yeah, there's a lot of data on this. And so I think everyone needs to be a lot more accountable or held to accountability when it comes to the information they're putting out.
Hi. Oh, sorry. I had one question. What you found on social media in terms of like designs and format, has there been one recently that's spoken more to users or has shown more engagement?
Yeah, that's such a great question. I was actually just talking about this to a friend of mine, Ty from the local. I don't know if you guys know about the publication. It's an incredible publication. But one of the things we were discussing is that people actually like to consume information in different formats and different ways. And I think that when you are building your follower base, very often your follower base ends up being people who like to get their information in the way that you tend to provide it. So for me, I am a reader. I actually tune out podcasts. I don't, like to watch videos. I suck at it anyways. And I also myself I don't get information myself from these sources. And so I don't do TikTok because of that. I don't do videos because of that. Mine's very, very written, stylistic, but I've realized that my followers are actually folks who prefer to get information in similar ways. And so there are times when I've sort of, gone, and tried to do different things where I've made a video and it doesn't resonate with my followers. Whereas you'll see in other SciComm platforms, in fact, are fully 100% video based, and that is all their followers want to engage in. And so my personal motto here is that's the best part about social media, is that you don't have to stick to one different format. You can actually try different things based on how people want to get their information, and you can test out things and see what works and what doesn't work and change accordingly, right? And so I tried something, did not work. My followers really did not care for information in that way. And so I don't actually think there's one great way, one perfect way. I think the way is every way, and I think everyone should be doing different formats. You don't necessarily have to do all the formats yourself as one individual, but collectively, as you know, the healthcare community, we can all tackle different formats, because that way we get information out to in the way that people actually want to consume that information. And again, the best part about digital, you know, is that you can try things like videos and interactive features, et cetera, which you can't do when it's print format, right? And so try different things and see what sticks, and what you enjoy doing is also really, really important.
That's wonderful. Thank you.
Can I just ask what so we have our own sort of institutional social media accounts, and we use a response framework for when we've, like, thankfully only had a few times where we've had really problematic feedback on our posts. You obviously have a much larger following. How do you kind of navigate that space of constructive criticism and feedback and cultivating that curiosity versus managing unhelpful actors, let's say?
Yeah, what a great question. And again, this is something that I've had to hone over time, because unfortunately during COVID, I got retweeted by Donald Trump Jr., which resulted in some of the worst weeks of my life. Thankfully, again, my husband, you know, is a tech geek, and so he went into overdrive and locking. And I sit on many boards, and so my address was out in the open because, you know, it's part of public information. And so he went on overdrive trying to like get my some of our personal life in under lock and key. But this is something that I've had to over time learn what works and what doesn't work, because I do want to foster an environment where people can have open dialogues and open discussions. That is important to me. But here's the thing: if I'm actually encouraging people who are not acting in a way that is conducive to a good dialogue, it's actually not just making the space unsafe for me, but it's also making the space unsafe for all of my followers, because then they don't feel that they are in a safe space where they can make comments or engage in dialogue. So it is really important for me to ensure that when I am posting things, that the conversation is a healthy conversation. It's an open, you know, judgment-free conversation, but at the same time, I have very low tolerance for actors who I know are not actually, you know, playing right or playing nice. And so there are many ways that I actually have tried to counter it. And so, you know, using things like restricting someone on their comments, so you have to actually approve their comments before it gets public. That's an Instagram feature that you can use. On Twitter, very often I have it limited to who I follow or followers of followers, etc. Because again, I'm trying to control the people who can respond to my posts. And that became necessary just because, unfortunately, you know, I think if I get 2 great responses, I get 20 not so great responses. But how do I make that space safe for the 2 responses is equally as important to me as like shutting down essentially these folks who are not there to play nice. So there's many different formats you can use to do that. On Instagram, the other thing I do is like I make sure that to comment on any of my posts, you have to be following me. Again, that's the one more layer that people have to take to be able to post their comment. If they're actually committed to a dialogue, they tend to do that more. But if they're not committed to a dialogue, that actually wards them off really quickly. So I think social media needs to do a lot more to give us more options to curate the space for us better. And again, that's another place where I feel we should be holding social media accountable too. But again, you know, keeping that balance is hard.
We're 1 o'clock. So thank you again so much for your time. That was really eye-opening. And yeah, thank you everybody for attending. People who are here, we have pizza down. Is it downstairs? Yeah.
Yes.
Okay. D203. Okay. Thank you, everybody. Thank you.